Today, we're diving into canine infectious respiratory disease complex, often called CIRD or CIRDC. By the end of this video, you'll know what causes it, how it spreads, the signs to watch for, how we diagnose and treat it, and most importantly, how to protect your dog from outbreaks. I'm Dr. Jonathan, and here are the key questions we'll cover today. What causes CIRD? How is it transmitted? What's the incubation period? What are the symptoms and red flags? How is it diagnosed and treated? What are complications, morbidity, and mortality? And finally, what can you do at home and how can you prevent it? First, let's clear up a common myth. CIRD isn't just one disease. It's a syndrome, meaning multiple viruses and bacteria can cause very similar signs. You might also hear it called kennel cough, canine cough complex, or infectious tracheobronchitis. The key point, this is a team effort between several pathogens that inflame the respiratory tract and trigger that classic cough. The most common culprits and causes include canine parainfluenza virus, canine adenovirus type 2, Bordetella bronchoseptica, a bacterium often linked with kennel cough, canine influenza virus, and less commonly, canine distemper virus in unvaccinated dogs. Often, one pathogen opens the door, damaging the airways, and another jumps in as a secondary invader. So how does it spread? Primarily through aerosol droplets when dogs cough or sneeze. Direct contact with nasal discharge or saliva also spreads it. And don't forget fomite transmission, contaminated bowls, leashes, or surfaces. High-risk places include boarding kennels, shelters, grooming facilities, dog parks, and daycares. Even a dog that looks healthy may be shedding the germs. The incubation period is usually 2 to 14 days. Most dogs show signs within the first week after exposure, but that window depends on which bug is involved. Clinical signs. Here's what to watch for. A sudden, harsh, honking cough, sometimes followed by retching. Sneezing, nasal or eye discharge. Mild fever or loss of appetite or low energy. Most cases are mild and self-limiting, but in some dogs, especially puppies, seniors, or those with weak immune systems, the infection can progress to pneumonia. That's when you'll see difficulty breathing, faster breathing, or lethargy that doesn't improve. Diagnosis. Usually, diagnosis starts with your vet asking about recent exposure, like boarding, dog parks, or shelters, and listening for that classic cough. For mild cases, a clinical exam may be enough, but in severe or outbreak settings, we use PCR panels to identify viruses and bacteria, cultures for Bordetella or Mycoplasma, and chest x-rays to check for pneumonia. Sometimes we'll run blood work to evaluate inflammation or rule out complications. Course and complications. Most cases last 7 to 14 days and resolve with rest and supportive care. But complications can happen. Bacterial pneumonia is the most serious, leading to labored breathing, low oxygen, and rarely sepsis. Some dogs develop chronic bronchitis, especially if they have repeat infections or underlying issues. Morbidity and mortality. CRD has high morbidity, meaning lots of dogs can get sick during outbreaks. But the mortality is usually low in otherwise healthy dogs. The biggest risk is in vulnerable groups, where pneumonia can be life-threatening. Treatment. Treatment depends on severity. Mild cases. Rest, isolation, hydration, good nutrition, and sometimes cough suppressants. A humidifier or steam can soothe irritated airways. Moderate to severe cases may include antibiotics like doxycycline if a bacterial infection is suspected. Dogs with pneumonia may need hospitalization, oxygen therapy, IV fluids, or nebulization. What about herbal or home remedies? Things like honey, licorice root, or echinacea are sometimes used, but there's little scientific evidence they cure CRD. At best, they may soothe the throat. Always check with your vet before adding supplements. Prevention. Prevention is where you can make the biggest difference. Vaccines are available for Bordetella, parainfluenza, adenovirus type 2, canine influenza, and distemper. They don't cover everything, but they reduce severity and spread. Biosecurity measures matter too. Good kennel ventilation, disinfecting surfaces, avoiding overcrowding, isolating sick dogs, and reducing stress. Think of it like layers of protection. Vaccines, hygiene, and smart management all work together. So, is kennel cough just one bug? Not at all. It's a whole group of respiratory infections we call SIRD. The good news, most dogs recover fully. But knowing the red flags, seeking care early, and practicing prevention can keep your pup safe and stop outbreaks before they start. I'm Dr. Jonathan. Thanks for watching, and give your dog an extra belly rub for me. Stay safe, and I'll see you in the next video.